Ray. You still like
Yes.
Raywat.
But it's what he prefers. And we had the conversation because I figured 17 months into our relationship, I should ask him. I said, I feel like I could call you Ray now. I could shorten it up. And he said, actually, he prefers it. Am I right?
I also go by my lord. So whatever you prefer.
Hey, well,
Raywat, when you look at the country as a whole and the pockets that we are seeing of the fourth wave of COVID, what's your assessment of how we're doing right now, August 30th, 2021?
It continues to be a tale of four provinces, Ontario, Quebec, Alberta, and BC. And all four of those provinces are deep in their fourth wave. However, there seems to be a slight bending of the curve in BC and in Quebec. And it might be too premature to say that definitively. But I'm an optimist and I see good things when I can. But everyone's still in crisis mode. And we have the USA now banning travel to Canada, which is telling. It tells us that other countries are perceiving us as having a problem with the epidemic right now. So we got to get things under control.
We have a mask mandate now, indoor mask mandate in Manitoba. And then later this week, most everything that you would do involving others, including going to a restaurant inside or outside, you need to be double vaxxed. Does that prevent or delay the fourth wave coming to a province like Manitoba?
It delays it. The way to prevent it is to seal your borders and prevent all incoming infection from happening until infection rates go down everywhere else. But you're going to see something resembling a fourth wave. The question is, how big will it be? It might be well blunted if you do all these proper things. And I'm glad to see that these restrictions are being enacted when they are.
today, 34 cases, over 3/4 of them among people who are not fully vaccinated. I don't think that's a surprise. Is that fairly typical of what we're seeing across Canada? Because I think we're all trying to explain to people who aren't vaccinated that, yes, they are part of the problem because we are concerned about healthcare capacity.
That's exactly right. This is a pandemic of the unvaccinated, we keep saying, because the vast majority of cases will be amongst the unvaccinated, and the even higher proportion of hospitalizations will be amongst the unvaccinated. And one could argue that it's their right to be unvaccinated, and that's true to a very large extent, but it does affect other people because, as you say, it affects our ability to seek health care when we need it for non-COVID reasons.
And I think that's the big takeaway, because here in Manitoba, we were sending people out of this province to get ICU treatment. There are thousands of surgeries delayed, medical treatments that didn't happen as a result of COVID patients filling the wards. And ultimately, there could be other deaths as a result, not of COVID-19, but because of the capacity being overtaken by these unvaccinated patients in hospitals. Is that a fair assessment?
Oh, that's exactly right. And remember, even in non-pandemic times, Canada has one of the lowest rates of free hospital beds amongst OECD nations. When this is over, I hope we have a reckoning about our healthcare capacity in general. It's poor to begin with. And the poorness has little to do with the actual physical assets, but a lot to do with our healthcare workers. We don't have enough healthcare workers to absorb the number of people seeking care, both for COVID reasons and for non-COVID reasons.
We're starting to see, in some cases, some pockets across the country, COVID back at personal care homes. Where do you see, and under what circumstances do you see another round of vaccinations?
Wow, that's a really interesting question. It'll probably be directed at those who are most vulnerable and those who got vaccinated early. So the extreme elderly, those who are immunocompromised, and those who got vaccinated in the original round of vaccination, sticking to the original interdose interval of 3 weeks, because immunity seems to wane amongst those with the smallest gap between first and second doses. And that means those who got vaccinated early. So I wouldn't be surprised if many provinces start exploring this before the end of the year for those populations.
Raywat Deonandan is with us, University of Ottawa epidemiologist. Has there been any work and any numbers that have come through studies to determine if people that were unvaccinated were more inclined to get it once certain rules were brought in, i.e., you need to be fully vaccinated to get on a plane, to get on a train, to go to a movie theater, to go to a restaurant.
Yeah, all those things seem to ratchet up the population level of vaccine uptake. What we see in France right now, when they made it mandatory to do a lot of things, is the vaccination rate in France now incredibly overtakes the EU average. What we saw in Quebec when their vaccine passport was arrived, within 24 hours, the bookings for first shots doubled, I believe. And we're going to see the same thing in Ontario when that eventually happens, as I think it will. So there's no question that by making it difficult for unvaccinated people to access certain things for reasons of public health concern, that you're going to incentivize that group to seek vaccination when they otherwise would not have done so. Remember, the reason for enacting these restrictions or these barriers is to cajole the apathetic. That won't be everybody, but it'll be a large enough chunk of the vaccine resistant to move that needle somewhat.
Some are still saying, listen, can we ever get to herd immunity if we cannot vaccinate 0 to 11-year-olds?
I don't think we can. I think that population is needed for that purpose. Now, they may become infected naturally and gain immunity that way, and that counts towards herd immunity. Absolutely it does. That's not an ideal way because nobody wants to get infected naturally. It comes with the risk of hospitalization and death, whereas the vaccine has a vanishingly small risk of adverse events. But yeah, for that group would have to achieve some kind of immunity for us to have the herd immunity conversation.
Any idea as to when we're going to see our children under the age of 12 vaccinated?
That is a loaded question. I don't know for sure. I know that the trials are underway, and I expect we'll see data relatively soon. And if I were a betting man, and I am, I would say sometime in November is when the data will be available, and I anticipate Health Canada make a decision in weeks after that. But who knows what the decision will be? It depends on what the quality of the data shows.
Raywat, we'll appreciate the time, or Ray, we appreciate your time. We will
My
talk
lord.
again.
You can call him Rich.
In
You can call him Rich.
the days ahead, the name, not the bank account. Thanks again for joining us this afternoon.
My pleasure.